So last time we talked about the skull bones. There are 8 skull bones, cranial bones, and 14 uh, facial bones, right? So we know all those, as well as the bone features. One of the things I want to make sure you guys are able to distinguish are the sex differences. So between the male skeleton and female skeleton, there are actually distinct differences about whether this skull is male or female. And that a lot has to do with the hormones that you get through childhood, and that affects the shape of your bones, including genetics, right? Of course, a lot of the your genes are what dictate what the morphology of your bones will look like, as well as the hormones that are produced. But in general, what we have seen is that female skulls tend to be a little bit smaller. The supraorbital margin, the one above the orbit right here, tends to be thinner and sharper compared to the male skull. So, if you think about the classic cartoon of a caveman with really bushy eyebrows, that's where it comes from, right? They have a very thick, heavy supraorbital margin above the eye, right? So that's where the eyebrow comes in. A very prominent superciliary arch right there as well. Um, when you look at the mental protuberance, the chin, the men tend to have a very square mental protuberance, while a female skull will come down and to a sharper triangular mental protuberance. If you look laterally on the skull, especially here, I want to point out here, this is the squamous suture. I did mention, I incorrectly said something else on Monday, but this is the squamous suture. There's the coronal suture. That's the pterion. If you look at the skull laterally, the male skull tends to be a little bit larger and round. It's like circular, whereas the female tend to be longer, elongated, and sloping a little bit. If you look at the frontal bone, it comes down more vertically for the female. It slopes at an angle for male. You have a more prominent occipital protuberance here. And if you look at the chin, this is actually one of the best ways to identify a male skull versus a female skull. If you look at the angle of the mandible, okay, so this is the mandibular angle right here. If this is more 90 degrees, straight up and down and perpendicular to each other, this is more likely male. If you have an obtuse angle, so if it comes greater than 90 degrees down here, that tends to be a little bit female. So these are little clues that you can look at and tell whether they are male or female. One thing I do want to point out, juvenile skulls will have a lot of features and characteristics that are similar to female. Okay, so they tend to be a little bit smaller, like skulls of children tend to be a little bit smaller, a little more elongated, a little more round, a little bit rounder. So you may, that's something to watch out for. It's not always definitive like that, because you can get confused between more juvenile and female skulls in general. Okay. These are differences that I do want to make sure you understand, and it could show up on test. So a little bit about the aging of a skull. Infant cranial bones, they're actually separated by several different bones. Okay, so there are actually more bones on an infant's skull, and they're all connected by connective tissue, really kind of flexible connective tissue called fontanelles. So the bones here are all connected here by this jelly-like material, this fontanelle, right? And there are two major areas that I want you to pay attention to. So this is the anterior fontanelle. That's between the frontal and the parietal bones right here. And then on the posterior end, there you have the posterior fontanelle between the occipital and the parietal bones right there. And then there are gaps and spaces, like the sphenoidal fontanelle, the mastoid fontanelle. But the ones that I want you to pay attention to are the anterior fontanelle and the posterior fontanelle. And so if you ever held a baby before, and they tell you, well, don't poke the skull, right? Don't poke the head. Because there might be soft spots. That's what they're talking about, right? This fontanelle is a soft spot in the skull, where on the other side of this, it is the brain. It's developing, and it's not about 9 to 15 months where the skull bones begin to ossify. So the posterior will ossify around 9 months. The anterior will ossify around 15 months. Can you guys think of a reason why an infant may have these fontanelles where it's a little more flexible and where you have these bones separated? Like, why would an infant have that?
Like the flexibility and to help with growth.
To help with growth, okay, that's a really good guess. To help with growth, because infants are small and they're always growing, and they're growing rapidly. So not exactly, okay, that's not exactly the reason why. So this skull, as it comes out through the vaginal canal on birth, okay, it's actually a lot bigger, right? It's bigger than you would think. It's like the size of a grapefruit, right? And to push that through your vaginal canal through birth can become very painful when it's just a giant rock of a skull, right? So when the bones are separated like this, connected by a flexible fontanelle, the bones can actually slide on top of each other. Okay, so it can squeeze and slide on top of each other, so the baby can actually go through the birth canal a little easier. But yeah, that's actually where that comes from. And then about 9 to 15 months, that's when it really ossifies and solidifies to become a complete skull. Any questions about the skull? No? Okay. So the next set of bones that I want you to learn are the vertebral column. Okay, so there's quite a few bones in here, but it's pretty easy to remember. What do you think are the major functions of the vertebral column? Of course, with almost any other bones, it is for protection. Go ahead.
No, just said support, but never mind.
Yeah, support. Yeah, and I showed it on the screen right here. So vertical support, right? We're all, based off of Homo erectus, we stand erect, we stand up straight, and our vertebral column helps us stand up, right? Supports the weight of the head. Really, it's you're lifting the head up, and your vertebral column is what supports everything above it. You maintain an upright position. The vertebral column will also transfer the weight from the axial skeleton to the appendicular. So you transfer all the weight onto your legs, right? To keep you upright. Protection. Yeah, almost everything is for protection, but in this case, we're protecting the spinal cord. It's a very important part of the nervous system. So we'll talk about how that protects the spinal cord. And then provide a passageway for spinal nerves, and then we can show how that works as well. So you have 26 bones here, all right? And I know it seems like a lot, and it is, but it's actually very easy to remember, okay, on how to name it and where they are and where they're placed. So there are 5 major categories of vertebral bones, 5 major categories. The superior 24 bones, so the top 24 bones, are divided into cervical, thoracic, and lumbar. Cervical is neck, okay? That's what cervical means neck, and there are 7 of them. Thoracic is the next section, and that's around your rib cage. That's the thoracic region. Okay. And then lower is the lumbar. Okay, that's lower back. That's your lumbar region. So there are 7 cervical bones, 12 thoracic bones, 5 lumbar. And then the most inferior bones are the sacrum or the sacrum and the coccyx. And these bones were actually separate bones in your childhood, which fused together later in life, and probably in your teenage to your 20s to your 30s. That's when it started fusing together into a complete bone. Okay, so 7 cervical, 12 thoracic, and 5 lumbar. And the way you can think of it is, well, you have breakfast at 7 a.m., you have lunch at noon, 12 noon, and then you have supper or, a snack at 5. So that's your lumbar. So 7, 12, and 5. And then you have sacrum and then the coccyx. So there are your spinal region, your vertebral column has a natural curvature to it. Okay, a natural curvature to it. So it bends anteriorly in the cervical region. So it bends out towards the front. And then through the thoracic, it comes back posteriorly, comes back posteriorly. And then through lumbar and sacral, it comes forward again. Okay, it comes forward again. Why would you think that your spinal region, your vertebral column, will have this natural curvature? Why do you think it bends like this? You're not a snake, you don't bend like that. You want to stand up straight. Why would it have this bend, do you think?
For
For
posture.
movement.
Posture. Okay, what else?
Movement.
For movement, for some flexibility. Yeah, that's very good. It's actually for balance. Okay, it's for balance. So if you think of your head right here, okay, if you think of your head resting right here, you're kind of like a lollipop, right? You look kind of like a lollipop. And if a lollipop is up straight like this, you're going to fall over more often. When you walk, when you sit, whenever you do anything, you're going to fall over because your weight is just coming down straight up and down like that, right? Down your spinal cord, your vertebral column. But if you can distribute the weight in this way and then this way, and then shift the weight again this way, you're a little more balanced, right? You're a little more balanced. And so your giant heavy head right here won't tip you over. Okay, so this curvature to your vertebral column is natural. It is supposed to be there. There are curvatures that are not normal. These are spinal curvature abnormalities. So we talked a little bit about this last week, but some of these abnormalities include kyphosis. So you might have seen this on older people like your grandma, your grandpa. They have a hunchback, right? They will bend a little bit over and their back is bent over. And you're like, well, grandma, why do you have a hunchback? Why can't you sit up straight? Or, why can't you stand up straight? Why are you slouching? And it's because as we age, a lot of the muscles pull it forward. Okay, pull your vertebral column forward, and you don't have the muscle tension as you age to actually sit back right. Okay, so unless you train your muscles, your back muscles, especially when we get through the muscle section, if you don't train your posture muscles, you're going to develop kyphosis. You can develop this hunchback, and it becomes really, really difficult to fix later in life. So when your mom tells you to sit up straight, yeah, you should really listen to your mom. Don't slouch, sit up straight, work those posture muscles, because later in life, when you go through kyphosis, those muscles will deteriorate on the back, and then you just bend forward. Okay. We mentioned a little bit about lordosis before. Okay, so when we talk about heavier people, or I mean, this affects pregnant women as well. When you're carrying like a basketball here for 9 months, right? Your vertebral column is going to compensate. You're carrying that thing for a long time, and your vertebral column will try to compensate. And what happens is that your lumbar region will push forward. It's going to push forward to help compensate, carry that weight, and if you're not careful, you can get stuck that way, right? Your muscles pull that way, your vertebral column pulls that way, and it gets stuck like that. So, especially for pregnant women, you have to be very, very careful about lordosis. And then scoliosis is when we're looking at this at a frontal or posterior view. It bends and it curves like an S, like this. Affects a lot of children. You know, a lot of people a lot of kids are born with this. And you know, you might have seen it on the playground when you were a kid. Someone with scoliosis, they had a back brace, and this can be corrected, of course, but you're gonna have to wear a brace or through surgery. You're gonna have to correct it through that way. And all of these abnormalities limit, you know, not just how you stand up straight, your posture, but your mobility, right? Because your vertebral column is, you know, really, really important in your mobility. And if you limit the way it looks, the natural curvatures, you will limit the ability for it to bend. All right, so let's look at vertebral anatomy a little bit, right? So, like I mentioned before, there are 26 that you know, you have to remember to name, but they're really easy, especially if you know what region you're in. So cervical is C. So you have 7 bones, C1 through C7. You know, you just go from superior to inferior. C1, 2, 3, 4, 5, 6, 7. That's your cervical bones. And then in your thoracic region, it's T. So T1 through T12. Those are your thoracic bones. And then lumbar is L1 through L5. Okay, so just you go from top to bottom and you just number it that way. So it's easy to remember and it's easy to name. All right, so super, super easy. Sacrum is S1 through S5. Even though there's one sacrum, it's actually a fusion of 5 bones. And then coccyx is a fusion of 4 bones, and it's you don't want to get confused with cervical, so coccyx is CO1 to CO4. Okay, so that's how you name those bones. So pretty easy. Now, a lot of these vertebral bones have very similar anatomical features and characteristics. We call them typical vertebra. They all look the same. They all kind of have the same features to them. And that includes C3 through C7, T1 through T12, L1 through L5. Okay, so pretty much all the cervical, all of the thoracic, and all of the lumbar. What are we missing here? So from cervical, we're missing C1 and C2. They look different. Okay, C1 and C2 look different. And then the sacrum and the coccyx, that looks different as well. Okay, but let's start with the typical vertebra. What do they look like? They all have what we call a body. This is a body. Okay, that's a big bulk of the vertebral bone right here. Okay, it's solid. This is the body right here. Then you'll behind the body, you'll have an arch. This is vertebral arch here. Okay, so between the body and this arch, you're going to make a hole. And what's a hole again? Foramen. This is the vertebral foramen. Right, this hole is the vertebral foramen. So you have the arch, you have the body, and the foramen. What do you think goes through this hole? What do you think goes through the vertebral foramen?
Spinal nerve.
Spinal cord.
Spinal cord, spinal nerves. Excellent. Very, very good. Yeah, spinal cord. Okay. So when we say the vertebral bones protect the spinal cord, this is how it protects it. Okay, so spinal cord goes right through this, and all the bones around it will protect it. All right. So on the vertebral arch, you also have these horns that come up. That's the pedicel. Okay, that's the pedicel. Sometimes written as P-E-D-I-C-E-L, P-E-D-I-C-L-E. Either one is okay. Okay, either one's okay. And then this bridge right here to help form the arch, this bridge is called the lamina. So you have the pedicel and the lamina. Okay, and that's a vertebral arch. And then sometimes you have things that stick out, ears that stick out right here. Okay, the ears that stick out. So anything that sticks out is sometimes called a process. Okay, a process. And since this sticks out to the sides, these are known as the transverse processes. The transverse processes, okay? The ears that stick out on either side. And then on the back, you have another thing that sticks out, a process. Another thing that sticks out, okay? This is a process. And this is the spinous process. The spinous process. And if you put all the spinous processes from all the vertebral bones together, you get your spine on the back, okay? So this is why we call it the spinous process. It's the spine on the back. All right. If we look at this from the side, you'll see in between the bodies is an intervertebral disc. This is actually makes up a quarter of your entire vertebral column, a little shock absorber in between the bones to help with compression. It also helps with the bending of the torso. Okay, so here's a typical vertebra. You can see in between a disc right here. This is your intervertebral disc. Intervertebral disc. Here's your intervertebral foramen right there. And if you put all of the vertebral foramen together, you're going to get that canal, vertebral canal. That's where your spinal cord goes. All right. So even though you know, the typical cervical, thoracic, and lumbar all kind of look the same, they have the same features, there are some major differences. And I definitely want you to know the major differences for the test. Okay. So cervical vertebra. Let's start with cervical. There are 7 of them. So C1 through C7. Okay, C1 through C7. These vertebra are the most superior. They are the most superior. So they are closest to your head. They are in your neck, right? The body here is the smallest. It is the smallest out of between your thoracic and your lumbar. Cervical is the smallest. Now, why would you think that is? It's because it has the least amount of weight to support, right? It only has to support your head and nothing else, right? Because we're going down. So least amount of weight, you don't need a big heavy body. So it's the least, and it becomes the smallest body. The foramen here, though, this vertebral foramen here by the arch, that's the biggest. It's the biggest hole. And that's because you have the biggest spinal cord, like brainstem. You're closest to the brain, right? You're close to the brain, biggest brainstem, biggest spinal cord has to go through this giant hole right here. So small body, big hole. That's cervical. And then if you look on either side, transverse, okay, the transverse process. On either side, you have these holes. This is your transverse foramina. Transverse foramen. 1 transverse foramen, 2 transverse foramina. And that's where your spinal nerves will go through, and your larger arteries, like your carotids, will go through your neck, right? And it's going to go through this. So big blood vessels will go through these giant holes, the transverse foramen. Okay, so small body, large vertebral foramen, and then you have these transverse foramina on either side. And then we get to thoracic, 12 thoracic. Okay, the body is heart-shaped, kind of looks like a heart, right here. But the thing that is typical of thoracic is that you're going to have these long transverse processes right here. The ears come out really, really long. They're the longest ones. And the reason why you have these long transverse processes is because what is attached to it are your ribs. Okay? Attaches like that. Those are your ribs. So you have 12 thoracic vertebrae, and you'll have 12 pairs of ribs. So each of the ribs will attach to one of the thoracic vertebra. And it attaches through the transverse process. And actually, to be very fair, what happens is that it goes like this. It bends a little bit. So it'll bend like that. Okay. And then when we get to lumbar, it's lower, right? It's the most inferior. It has the most weight to support. So you're going to have the largest body. Largest body. No transverse foramina. Okay. So no holes on either side. Very short, stubby transverse process. No costal facets. Costal means rib. Costal means rib. So no costal facets here. The spinous process is very short and thick right here, but biggest body. Okay, so you can tell it's the biggest one, and that's lumbar, right? And only 5 of them: L1, L2, L3, L4, L5. And then you have 4 atypical, so non-typical vertebra. You have C1, which we call the atlas, C2, which we call the axis, the sacrum, and the coccyx. So the atlas, C1. And on the test, you can either write C1 or you can write atlas. All right. So same thing. You just know that C1 is the atlas. And if you know your Roman mythology, do you know who Atlas was? Atlas was a Roman god that held the world up, right? And in your world, your world is your head. So the vertebral bone that holds up your head is the atlas. This is one that touches your skull. It articulates with the condyles of the occipital bone. Okay, those stepping stools of the occipital bone that I showed on Monday. Deep articular facets right here. And no body. There is no body, just giant hole. So just giant hole here. It's the only one that doesn't have body. You'll have 2 holes on either side right here, the transverse foramen, but no body, and just a giant foramen right there. C2 is the axis, And you can tell it's the axis because it has a body here, but then a finger that sticks up, a little finger that sticks up. This is known as the odontoid process. It's the odontoid process, okay? That's what sticks up. It's also known as the dens. So on the test, you can either write the dens or the odontoid process. Either one, fine. It's okay. And what happens is that you have the atlas sitting on top. Okay. And through the hole, you have a ligament that crosses the dens. This is the transverse ligament. It crosses the dens. And what this allows is your atlas to rotate back and forth. So when you're shaking your head, no, 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 it can rotate along this axis. That's why you call it the axis. Along this axis, so you can rotate your head back and forth. Okay. So you have the dens, where you have the transverse ligament on across it, and allowing your atlas to rotate across the axis. So that's C1 and C2. And then we have the sacrum, which looks very different. Okay, it's kind of like a a triangle with flaps right here. Originally, it's 5 separate bones, but usually in your 20s and your 30s, that's when they fuse together into one bone, which we call the sacrum. Okay, but you can see some of the separations, and we'll number them S1 through S5. You can definitely see the foramina here, the holes, and you can count the holes on the back. That's the dorsal sacral foramina. Major structures are these wings on either side. That's the ala. That's the ala. And then the sacral promontory, where L5 sits, L5 will sit right on top of that, the sacral promontory. Okay. Here's another look at it. S1, S2, S3, S4, S5, but only one sacrum. Okay, it's a fusion of 5 different bones. The sacral promontory, the ala, and then you have the sacral foramina, the sacral holes right there. And then the most inferior bone is the coccyx. This is the tiniest one right here. It's actually a fusion of 4 bones. Again, you label it CO1 to CO4. And again, in your 20s and 30s, that's when this will fuse into one separate bone. This is your tailbone, the coccyx. And if you were ever to sit down really quickly, or you fall down on your bum, that's the thing that you break off, right? That's your tailbone that you break off. So pretty fragile, but it'll break off. Any questions on the vertebral column? No? So we're going to quickly go through the thoracic cage. This is your bone, your ribs, okay, your thoracic cage, as well as your sternum, right? Your sternum and your ribs. Protects the heart, the lungs, your trachea, esophagus, thoracic organs, all around your chest area. Okay. 12 pairs of ribs, so 24 altogether. And then you have your sternum right here. So let's start with your sternum. This is your breastbone, okay, across your chest. Kind of looks like a necktie right here. It's actually 3 separate bones that have fused together in your 40s. And for many of you, it hasn't fused yet, but in your 40s, it'll fuse into a single bone and into your sternum. Okay, so it kind of looks like a necktie. The knot of the tie is known as the manubrium. This is the manubrium, the body, and the xiphoid process. Okay, so the manubrium is the knot, and this is what connects to your clavicle. All right, connects to your clavicle. And then the other ribs, your other ribs, will connect to the manubrium and this and the body as well. The xiphoid process is on the bottom. It looks like a little triangle or a knife right here. That's the one on the bottom. And these holes are supposed to be there. Okay. So manubrium, body, xiphoid process, clavicle, and then your ribs will start connecting. Do you guys know how to do CPR? Does anyone know how to do CPR? Yeah. So if you were to do CPR, of course, you compress the chest, right, to get your heart pumping. So you compress the chest, and you're actually compressing the sternum here. This is the bone that you want to start compressions on, the sternum. And yeah, unfortunately, a lot of the time, if you actually do it right, you can crack part of the sternum. You can crack some of the ribs as well. So with the ribs, as I mentioned, 12 pairs, so 24 on either side. Okay. They articulate posteriorly with the thoracic bones, as I mentioned before. Okay, so on the back, they come in contact with the thoracic bones, and then on the front, it will connect to cartilage. So all this stuff in orange here is costal cartilage. So costal again is rib. So costal cartilage, which then connects to the sternum. Okay. So you have true ribs and false ribs. The top 7 ribs, rib 1 through rib 7, they're known as true ribs because their costal cartilage connects directly to the sternum. Okay, so 1, 2, 3, 4, 5, 6, 7. Boom. They all connect to the sternum. False ribs do not. They do not connect directly to the sternum. So ribs 8, 9, 10, 11, and 12 don't connect directly to the sternum. So 8, when I look at 8, boom, it hitches a ride onto 7 and then comes back in. Okay, so that's false. 9 comes in, hitches a ride with 8, then 7, then comes in. False. Same thing with 10. 11 and 12 are floating ribs. They don't actually connect to the sternum at all. Okay, so they're kind of just floating out there. They don't articulate, hence a false rib. Some major structures of the rib: there's a head, neck, and the angle, a really long shaft or body, and a groove. Okay. There's also a bump right here known as the tubercle of the rib. So there's a head, neck, tubercle, angle, and then the shaft. Okay. The head and the neck, as well as the tubercle, is what connects with the thoracic bones. That's what touches and articulates with the thoracic bones. And then you have a costal groove, costal again, rib, that runs all the way along the shaft. And that's for your nerves, blood vessels. They go all along the costal groove. Ribs 2 through 9 articulate, so they join up posteriorly in 3 places. Okay, so the head will touch 2 bones here, and the tubercle will come back and touch the transverse process. So I know there's a lot of words here, and I'll show you on a different slide, but when we're talking about ribs 2 through 9, what I want you to remember is where it connects. Okay, so if we take, like, say, rib 6, it's going to articulate with the inferior demifacet of T5. So this will be T5, and this will be T6 right here. So if this is rib 6, this will be T5 and T6. And so it's going to touch the inferior demifacet of T5, the superior demifacet of T6, and the transverse process, those ears, of T6. This is the main one I want you to remember, the transverse process. So whatever transverse process the tubercle hits, that's the rib number. Okay, that's the rib number. So I know it can be confusing. Work this math out a couple times. And when we get back to the classroom, I want you to go to the models and convince yourself that this is correct.
Can you say that one more time?
Yeah. It is confusing. So what I want to do is actually take another model. Okay, I want to take a different model and show you, because it can be confusing. But if we look at this, okay, if we look at this, and I'm going to annotate this. Okay, so let's say this is rib 6 or 7. Let's say this is rib 7. Okay, so it's touching right here. It's in between 2 thoracic bones, right? We know these are thoracic. So it's T something. And this is going to be T something. And this is going to be T something, right? These are the thoracic bones. So what is it touching? Well, it's touching this inferior demifacet here. Let me draw. It's going to touch this right here. It's going to touch right here. And it's going to touch the transverse process behind this. It's actually right here, this connection right there. Behind it, right there. Okay? So let's see. Let's think about it. What thoracic bone would this one be? What thoracic bone is this?
6,
Why do you think it's 6?
because it's the one on top, right?
The one on top. Very good. This is T6.
Or
Okay.
the one superior, right?
Huh?
Yeah, sorry, continue, sorry.
Yeah, that's T6. And then that would make this T7. Right? And make that T7.
Yes.
Because one on top of the other, right? And then this would be T8. That's not hard. That's the next one that comes down. That's T8. Right? And then this transverse process is the transverse process for T7. Okay. Makes sense.
Yeah, we
What
got
if
it. Yeah.
Yeah, do you get it?
Yeah, I just didn't get the
This
transverse
is,
process, which I meant about that, but I get it now.
What if this was rib 4? Then you would have T3, T4, T5. Yeah.
Mhm.
So this can be any rib, and this can be any set of thoracic bones. What if this middle one is T3? This middle rib is this middle bone right here is T3. What would this rib be?
3.
3. Excellent. Very good. See, you guys get it. Or you get it. So I hope everyone else can convince themselves, and they can't. Let's work through it. Okay. Let's make sure that you guys understand this. Okay, so here's another look at it. The head, the neck, the tubercle. This is the tubercle that is in contact with the transverse process. The angle, the shaft right here. Okay, so the main one that you have to look for when you're counting ribs and counting the thoracic bones is the tubercle, because that's the easiest one, right? That's the easiest one to look at. What is it touching? Which transverse process is it touching? And that will tell you what bone it is. Okay. So I know that's the end of the slides. I do want to show you on this figure, because I think it might be a little bit easier when we can do this. So here's the manubrium, right? Here's a manubrium. I'm looking at this. Boom. All right. So here's a rib. Here's a rib right here. And I don't want you to count down. I just want you to look at this rib. So if this is rib 4, what bone is this? The 4th thoracic bone. And it just happened to be the 4th one. Okay, because this is where the transverse process is touching that tubercle. It's in contact with that tubercle right there, that bump. So this is going to be the 4th rib in contact with the 4th thoracic. And when I look on the inside and we zoom in, okay, inferior demifacet of T3, superior demifacet of T4 right there on the head. Do you guys see that?
I don't.
You don't. You don't see this connection?
Wait, I don't see. Well, I don't know if it's my computer's lagging or.
Yeah,
You guys don't see it on your computer screens, or?
your screen's showing something else.
Yeah, screen is still showing the slides.
Yeah.
Oh, Okay, let me stop sharing and then let me share again. What do you guys see now?
I see it.
Do you guys see the skeleton?
Yeah.
Okay, all right. Ooh. All right. So here's the sternum. Yeah, you see the sternum, you see the ribs. Yes.
Yes.
Okay, good. All right. So I'm gonna pick this thoracic bone. This happens to be the fourth thoracic bone. Okay. I don't want you to count. This is the fourth thoracic bone. Now, do you see the rib that is connected to it right here? I'll zoom in. You see this rib?
Yes.
Yes. Okay. So this is the tubercle of the rib. This bump right there is in contact with the transverse process of this thoracic bone. Okay. So this is the fourth thoracic bone, making this the fourth rib on the right side. It's the fourth rib on the right side. Okay. And this one is touching, this tubercle is touching the T3. So this is rib 3 touching the transverse process of T3. Okay. And then the connection on the front, when we look at T3, okay, is that rib 3 touches the inferior demifacet of T2, right there. The superior demifacet of T3, right there. And then, of course, I showed you on the back the tubercle on the transverse process. Do you guys see that? Yes.
Yes.
Okay. So you can see here, I mean, while I'm here, I can show you, here's the spinous process, all the spinous processes right there. All of the spinous processes. Okay, transverse processes, lumbar here, cervical. Okay. Manubrium. Here's the manubrium, body, xiphoid process of the sternum. And then you can see here it actually has a model of the hyoid, which we talked about last time. Here's a hyoid. And then there wasn't a great image before on the slides, but here's the axis. Okay, this is the axis. So here's the axis, very typical of the axis right there. And then up here is the odontoid process. That's the dens, the odontoid process. And when we bring those back, sorry, let me take away that for a little bit. You can see the atlas on top, right? There's the atlas, and then it connects to the axis like that. Do you guys see it? Yes.
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 Okay. Okay, good. And then do you guys think by next week you guys will be okay with with learning the bones?
Maybe.